nurse and doctor sexual tension. Classic for a TV show. All right, Dr. Ben Caughlin here. I'm going to review and commentate on Nip Tuck, which is a very raw clip, a video. So, you know, it does have some aspects of reality. And, you know, I think from a plastic surgeon's perspective, it's interesting to see kind of how we think. And this particular patient is sensitive to how he looks and feels, like all of our patients.
Tell me what you don't like about yourself.
Good way to start a consult.
Sadly obvious.
I thought it would only be fair to write a review of my
Pretty
appearance.
aggressive comment.
I'd like to hear it.
So this guy
In all my years, I've
obviously
never
doesn't
met
look
an uglier
exactly
human
normal.
being than August Walden. But calling him human could be construed as an insult to the phylum.
Got to be careful what you write in the
Please
medical
continue.
records.
Below
Patients
the
have
naked
rights to the medical
caterpillars,
records,
Walden
so
calls brows, two extremely far-sighted eyes droop like a basset hound's under the pull of gravity.
oof.
In fact,
Never
his
compare them to
entire
animals.
face looks
Not
as if it's been pulled
beneficial.
and stretched by a hyperactive toddler playing with silly putty.
All right, look. The other
Maybe a little
day I
too
was maybe
descriptive in
bit
those
too
notes.
harsh. If I'm the reason
You are the
you're
reason I'm here, Dr. McNamara. I am thankful for your words.
You know, patients
You were
do
right.
typically appreciate brutal honesty.
Frankly, the first person to say it to my horrific face. I have been isolating myself for years behind this Halloween mask.
It's important, you know, the people's facial appearance is a really powerful, it's a really powerful sense of self and a sense of how they communicate with, you know, the world. So it probably bothered this gentleman that severely, but pointing it out so directly, maybe a little too much. Makes good for good TV though.
Scaring away everyone with whom I come in contact. In particular, a young lady of whom I have grown fond. A lithe beauty of barista at the cafe.
Always about sex, no doubt. Nip Tuck and reality.
Every day, Doctor, I am there, trying to connect with her. Yet unable to hold her gaze for more than a mere moment. Can you help me connect with her, Dr. McNamara?
So, all right, this is good. This gentleman was truly trying to use his appearance to, you know, be successful with a young lady. So we get a lot of that. I often say my job is to get people laid. In the OR, little nurse and doctor sexual tension. Classic for a TV show, medical TV show. Not only made for TV. She's having difficulty intubating the patient, which means putting the tube in the throat to get him asleep.
And she broke it.
I have to intubate a fiber optic.
Now she's intubating fiber optically. That's using this camera. We do it frequently. Oh, I said nurse. It might be a doctor. It probably is a doctor, actually. So they're showing the tube going in the esophagus, which it's supposed to go in the trachea.
Nose, nose, anything goes. Thank you, nurse. How are we able to say
They're showing a 2D to prove or to act like they're cutting the nose. They're obviously not really cutting it here. The whole head moves when you're doing this. He's rasping right now. The head is shaking. Somebody has to support it. There's like nothing happening here. We definitely speak that sexually when we're doing procedures.
Shouldn't be that much blood.
Shouldn't be that much blood. Really ending it dramatically. It does bleed. The nose, the whole head, neck, face can bleed quite a bit. So the blood, I wouldn't say that was an excessive amount of blood. So viewer discretion advised. This is point of view from a doctor's perspective, or from the patient's perspective. Oh.
Check it out.
It looks like the patient is actually feeling the sensation and awake during the procedure, but she's paralyzed.
Stop, please.
Could happen. Oh, vey. And they're really, so they have the patient asleep. I'm not laughing, somebody walked in. I'm not laughing at the patient, but they have the patient asleep. And from her point of view, she's feeling the pain and surgery. It shouldn't happen this way.
And you can stop it at any time.
Okay.
I've been done with this already at night.
Stop, please.
Oh, it looks like he's repairing some trauma. Extremely rare this happens. You would still give lidocaine and epinephrine to vasoconstrict the area, so it should still be done.
Looks like she used a grapefruit knife.
And
What it was, share.
oof, most of the time we can do these cases awake, truly awake, with blocking the area. So making for good drama though. All right, he's taking off the facelift wrap. It looks like post-op day 1 from a facelift, maybe chin implant. Patience looks pretty good.
Perfection.
Ooh, perfection. Rare do we reach perfection.
Please. You've no idea what it's like to achieve the thing that you've dreamt about your entire life. And for the first time in my life, I'm content.
It's true. You make people happy, you'd be surprised.
Well, enjoy it
Small
while you
changes
can.
can really change somebody's life.
Because it won't last.
Dr. Troy, an artist, knows when the painting is finished.
You're not a painting, Mr. Poe. Nothing that breathes is ever finished. While you're alive, you'll seek and never find is God's sick little joke.
Oof.
But
That's
that's
the
not true.
truth. People
I can assure
often
you,
want, they
Dr.
want perfection and they want it forever.
I'm
So
completely satisfied.
I think a big part of plastic surgery is being realistic
What about
with
the excess
people's
fat around
goals
your
and
waist
what
or
can be
your
obtained.
pecs? They're just starting to lose their definition, and the skin beneath your brand new chin won't be long before that begins to sag. I'm putting you on the books for a rhabdectomy. 6 weeks should be long enough to recover.
Is that completely necessary?
And pectoral implants after that. You're flesh and bone, Mr. Poe, not some ideal, and you will continue to decay until you rot to
Kind
the
of
ground.
aggressive.
That's an awful thing.
So this is more the plastic surgeon's addiction to plastic surgery.
In fact, I think we should all look forward to our
It is that dichotomy of the surgeons. Who are we there to make happy, the surgeon or the patient?
After all, Mr. Poe, only the dead are satisfied.
Only the dead are satisfied. Something to that, but also we can just enjoy what we got. All right, yeah, Nip Tuck as a whole in this episode, is it true to life? Is it relatively accurate? I'll say I'm writing a book right now actually on the perception drift that both patients and doctors can have when we're trying to develop the patient-doctor relationship, particularly when it comes to plastic or aesthetic surgery. It's like, who are we trying to make happy? So, I mean, this is dramatic. They're dramatizing it, but I do think there's a reality to it. And I think, you know, it's a slippery slope. So, you know, who are we trying to, is it truly the patient is a work of art and we're molding them for our goals, or are we molding them for their own goals? So it's a kind of a deep question. Okay, listen, you can scroll through the videos, you can search whatever you want, or you can just freaking subscribe. It's easier. All my shit will come to you.